Hi, welcome to another video of Practical Mental Health. I'm Eric Mansfield. I'm a licensed clinical social worker, and this video is going to be about therapy. What is therapy? And this is to follow up with regards to stopping the stigma of mental health. So if you're out there, you're wondering what therapy is, hopefully I can clarify and give you the gist of it. There's a lot to it. Hopefully this video won't be too long. I'll just try to get down to the basics. Okay, so one thing I want to point out is that therapy is not all about mental illness. There are a lot of disorders. That's usually what we classify. As a licensed clinical social worker and a therapist, I classify things, diagnoses are disorders. They can be overcome, they can be resolved. My primary focus is not about treating mental illness or disorders or anything to that effect. It's treating pain and suffering. It's about helping my clients and helping you to improve quality of life, the quality of your life experience. Hopefully we can do that through understanding, educating you, helping you out, work through problems, stuff like that. But kind of getting ahead of myself. But so I want to make it clear too that when you are diagnosed, it is not a label. It's not with you for the rest of your life. These are all disorders that can be resolved. Let's take that back. Not all of them can be resolved. Like, for instance, schizophrenia. Unfortunately, my understanding is there's no cure. The best thing that I can do to help people who are experiencing hallucinations or mental delusions is to help them understand what's going on and to try to work through it and manage their life around those experiences, because apparently that's just not going to go away. There are medications that can definitely help, but it's always going to be there. I usually don't like to be sounding concrete like that, but unfortunately there are just some things that just can't be resolved or cured. So I don't want to give a negative prognosis on certain types of mental illnesses and disorders. And the idea of improving quality of life, even if you have a high level mental illness such as schizophrenia, there's still stuff that you can do about it. You can take medications. There are some medications that can be helpful. Unfortunately, I've had a lot of clients that have schizophrenia and they don't like the medication because it makes them feel off, like not themselves, and I get it. However, what's the alternative? Learn to live with the hallucinations or the delusions, try to figure out how to work through it, how to identify what's going on. Generally speaking, the modality for schizophrenia is reality testing and learning how to do that. However, on the other hand, other disorders like major depressive disorder, generalized anxiety disorder, everybody has feelings, and everybody experiences depression and sadness. Everybody experiences anxiety and fear. That also is something that's not going to go away 100%. The idea behind therapy is to help you understand what it is, how it works within yourself, and how to manage it, cope with it, reduce it, eliminate it. And there's a lot of different ways to go about that. Let's see, I think I mentioned I don't want diagnoses to be labels. Don't think of them as you're being labeled. That's part of the stigma of mental health. There are a lot of people out there that think that if you go to a therapist and you're diagnosed with depression, or ADHD, borderline personality disorder, bipolar disorder, any number of those, they think that that's something that's going to be carried with them for the rest of their life. And it's up to you whether or not you want to carry it with you, or if you want to work through the symptoms with a professional therapist and try to resolve those issues. There's a lot that you can do. So one of the things that I tend to do, and I hope that most therapists do, is focusing on symptoms. What is the symptomology? For me personally, and for a lot of therapists that I know and the way that I've been trained, we use the biopsychosocial spiritual approach. So basically the idea is identifying, are there any biological issues that are going on that can impact mental health? And there's a laundry list of physical ailments that people are experiencing today that affect that. The psychological piece that really gets into the symptomology. What are you feeling? What are your thoughts? The social aspect. Are you a loner? Are you a social butterfly? Introverts, extrovert. How does that impact you? And there is definitely a difference between introverts and extroverts. And just because somebody likes to be alone doesn't necessarily mean that there's anything wrong with that. My definition, or the definition that I've heard and I agree with, is basically somebody that's introverted basically gains energy from basically staying alone, like being in their own space, in their own time. That recharges their battery, because when they're in social situations, that drains them. Extroverts, on the other hand, they gain energy from social experiences, being out and about, being among people, and when they're alone, that drains their energy. And most people tend to fall somewhere in between. I'll say I'm an in-between person. I mean, I actually do gain energy from social activities and being around people, but at some point it does become draining, and at the same time, I actually need to be in my own space, in my own time, to recharge. So there's a balance there, and that's something that you're going to hear me say a lot, is trying to find the balance with life experiences, balance in emotions, because they're there. They're not going to completely go away. I mean, you can try to suppress it, but that's not healthy either, suppressing emotions. And that's something that I would hope that any therapist that you see would help you work through. Okay, so kind of getting back to what is therapy. The idea is that therapy should be a safe space for your self-expression. So when I have clients that come in, I try to explain to them, look, this is your space, this is your time. This is something that you can come here and you can express yourself fully. There is the whole HIPAA requirements, all that stuff. The idea of what happens in Vegas stays in Vegas. Well, what happens in therapy stays in therapy. I am not going to go out and talk to other people about it. You don't have to worry about the gossip train beginning with me. It ends here. That's what I mean by it's a safe space for self-expression. So, however, having said that, I am a mandated reporter. Every therapist is. If you report to me that you are going to go home and you're going to hurt yourself or you're going to kill yourself, I have to report that. That's when a TDO might happen. If you express that you're going to go and you're going to harm somebody else, I have a duty to warn, meaning I have to call the police and I have to notify them. And if I can, the person that you are threatening to do harm to, I have to contact them and let them know that, hey, you have actually expressed that you want to harm this person. So just keep that in mind. Okay, so Safe space with that exception, me being a mandated reporter. Also, as a mandated reporter, if you're under the age of 18 and you come in here and you tell me that your parents are beating you or are abusive on some level or another, I have a duty to call CPS. I have to report that. There's no way that you're going to stop it. I mean, I have had juvenile clients that did express that to me, and I had to disclose to them that I had to call CPS, and they begged me not to. Unfortunately, I had to report that, or fortunately, however you want to put it. It is not the therapist's job to conduct an investigation with regards to that. It's not my job to conduct an investigation. If a child or an adult or anybody reports to me that there is any kind of child abuse, I'm going to CPS. I'm going to tell them. Because that's got to stop. Child abuse has got to stop, period. But I'll get into that a little bit later with a different video, perhaps. Okay, so back to what is therapy. So when you come to a therapist, the idea is that our job is to help you process thoughts and emotions, to identify what is it that is causing you distress, hopefully to try to reduce the psychological distress. There's really not much that I can do with regards to physical distress, physical pain, physical suffering. I often will, try to review, okay, where are you going? What doctor are you seeing? Are you seeing specialists? Is there anything that you can do? Physical therapy? Is there anything else that might be helpful with addressing the physical issues? But the psychological pain and suffering, emotional distress, racing thoughts, even lack of sleep, I mean, those are things that we can address in therapy. And I can teach you, and I hope that most therapists can teach you any number of skills. And a lot of this stuff that I teach clients and that most therapists do is not being taught in schools, high schools. I mean, unless you take a college course or something. Honestly, I had to take 4 years of psychology and 2 years of my master's work in social work to really get an idea of how to approach that. So basically, in therapy, hopefully you get the gist of it. Hopefully your therapist will hone in on what your issues are and address them specifically. So when you come to therapy, I mean, there's a lot of different approaches. There's a lot of different reasons. You can come here and you can vent. It might be the kind of thing that you just want to get a lot of stuff off your chest and you don't want the gossip train. You can't. You don't feel like you can trust everybody that's in your life to not go talking about what you talked about. It can be helpful for you to work through problems. It can be helpful for learning and understanding what is going on within yourself, learning new skills, and especially for trauma reprocessing and desensitization. I mean, I can't stress that enough. Yeah, and so basically learning new skills, helping you learn how to regulate emotions, regulate your thoughts. And the idea too is like, what do you want to get out of therapy? That is something that I would ask you to ask yourself before you see a therapist. What would you like to get out of it? What is your approach? currently the job that I hold, the company that I'm working for, we actually require, and insurance requires it, we have what's called an ISP, so an individualized service plan, and that entails at least 3 goals, like 3 goals for treatment, what you want to focus on in therapy. Now, sometimes it kind of jumps around a little bit. Like, say, for instance, you want help with understanding and managing depression. That might be one goal. You want help with understanding and managing anxiety. You want help with understanding and managing anger. Or you want to learn communication skills, or you want to improve social skills. There's any number of things. But among those 3, it might jump back and forth. I try to focus on one at a time, but it doesn't always work that way. And there is also what I didn't really realize this, but strangely enough, Bart Simpson coined it, and I'm not sure if like the character or the writers keyed in on this, but the whole "don't have a cow, man." I know that's kind of weird, but COW does stand for Crisis of the Week. So the idea is that through my training, a lot of this stuff was about trying to avoid crises of the week, because that detracts from the goals of treatment. However, the crisis of the week is relevant because that's what's causing distress. The problem comes in when you come to therapy and decide, okay, I have 3 goals to work on, but every week I need to work through this crisis, and then you never actually get around to the goal. I would hope that most therapists can kind of configure and figure out, okay, the crisis of the week, how is that impacting certain aspects? Is that something that is associated with depression or anxiety or any of the goals that are on the ISP? That's generally my approach. What is the crisis of the week? How is it impacting them? And is this something that we can work in and work through with regards to the goals for treatment? Let's see. So I also want you to think about when it comes to therapy, it is very important for you to find a good match, a therapist that matches your ability, or your goals. You want a therapist that has the ability and the training for what is going on with you. And there's a little bit of I don't want to say really a problem, but like there can be a struggle with finding the right therapist, because not every therapist is trained in exactly the same modalities. Like there's a lot of different modalities for treatment. There's cognitive behavioral therapy, dialectical behavioral therapy, acceptance and commitment therapy, internal family systems, emotion-focused therapy, eye movement desensitization and reprocessing for trauma. And it's hard that, when you actually do try to find a therapist, trying to figure out what you need, that can be a really daunting task. Here with the agency that I'm working for, we have a really good staff with regards to being able to kind of get the gist of it at the beginning, like what are the problem issues. Is it a lot of depression, anxiety? What are past diagnoses? And they do a very good job with trying to match clients to a therapist that would be appropriate for them. That's going to be important. However, don't think that you have to go to one therapist forever. You don't. And in fact, I would actually suggest that you not have multiple therapists. If your insurance is paying for it, you can't have 2 therapists doing the same thing But what you can do is you can have a therapist that maybe you are processing emotions with. But that therapist may not be trained in trauma. And if that therapist discovers that you have some trauma that needs to be reprocessed, the idea is that they should connect you with somebody who is trained in EMDR or any other modality for trauma. Two different modalities, yeah, you can have two different therapists at this particular moment in time. Based on my understanding, I have actually had clients that have a regular therapist who isn't trained in EMDR, but then they're referred to me for EMDR. They come here, we do EMDR. When the trauma has been resolved or the distress levels are down to what they would consider manageable, then they go back to their regular therapist and continue with therapy in that way. So that's just an example. Can't have the same therapist, can't have two therapists doing the same thing, but you can have two therapists, different modalities for different aspects. Let's see. So the idea too, with regards to, I know it can be a daunting task, but if you say, for instance, you sit with a therapist and for whatever reason, you're just not feeling a connection. And to give you an example, I have actually had clients come in, they sat down, we did the assessment, and for whatever reason, they felt triggered by me. I think one client reported that I resembled somebody that abused him or her. And so the idea was, okay, yeah, that's not going to work. So yeah, I would suggest try to find somebody else that isn't going to trigger you. So it might be the kind of thing that you just feel like it's not a good match. You may sit down with a therapist and maybe they're not living up to your expectations. I would hope that every therapist is going to be there to educate you, is going to help you identify what is really going on, identify different approaches. Hopefully the modality that they're trained in will be helpful for that. I would hope that they're honest about it. If they actually say, you know what, I can't help you, but I would hope that they would say, I can't help you for this reason. You have these certain types of symptoms, this diagnosis. I am not well trained in that. I need to refer you to somebody that is. But that doesn't always happen. I've had clients that have walked into my office and have actually said, their therapist basically said, I'm sorry, I can't help you. And that was it. No explanation for why. That's wrong. I just think that's wrong. But it happens. Yeah, and so that kind of comes back around to, like, what are you looking for from therapy? Like, do you just want to come in and sit and vent? Or do you want feedback? Do you not want feedback? I've had a lot of clients that came in and said that their previous therapist just kind of sat with a clipboard, asked them some basic questions, and they just talked the entire time. My understanding is those therapists never provided any kind of education, never provided any genuine feedback. And what actually baffles me is that when I have clients that come in, have been with a therapist or several therapists for years, and I ask them, what coping skills have you learned? And they tell me none. Yeah, there's a problem there. I think that's a problem. That's, and that's my opinion. I mean, if you want to go to therapy and you just want to talk and vent, there's plenty of therapists out there that probably would do that. I'm fine with it. However, it's kind of ingrained in me that I can't just sit and Yes. Okay. Yeah. How are you feeling about that? I mean, those are basics for therapy, but at the same time, it definitely helps if you have somebody on a professional level who can give you feedback about where your thoughts are coming from. What maybe was the reason? Why are they there? Is it conditioning, childhood experiences, any number of things. Yeah, so it's one of those things where hopefully the idea is that, let me put it to you this way. So everybody, we are all on the inside looking out. I can't say that I've ever met anybody who said, you know what, I'm waking up this morning, I'm gonna screw up my day. I'm gonna make every bad decision. I'm gonna not feel good. I don't think I know anybody who ever actually said that. Not to, I mean, there probably are people who do, but I haven't met anybody that would actually do that. So the idea is that most people, myself included, try to do the best that we can. Try to make the right decisions. We try to problem solve, and we do everything based on what we know. However, being on the inside and looking out, you may not be fully aware of your behaviors, how it's impacting others. You may not be aware of your own self-expression, facial expressions, body language. You may not even be aware of your own emotional state from moment to moment. And I'm going to get into some videos about that. That's where mindfulness really comes in. So having somebody else who is professionally trained, hopefully the idea is that, they can key in on what your emotional state is, your approach. Are you expressing yourself in an appropriate manner or inappropriate manner? And question 2 is, are you willing to hear that? A lot of people aren't, but that's going to be part of growth, maturity, whatever, is if you can get feedback from somebody and actually really sit down and think about, oh wow, how am I expressing myself to others? How am I approaching people? How am I speaking to people? What are my behaviors? You may think that you know it, but from somebody else's perspective, it can definitely be helpful to get feedback in that direction. All right, let's see. Wow, I've rambled on for quite a while, and I hope that's not rambling, but yeah, like I said before, this is raw. It's all it is what it is. Me stumbling over my words. I don't have any editing equipment. I'm not going to edit videos. This is how it is in therapy, period. There's no, oops, I made a mistake, let me go back. I mean, if I make a mistake, I do correct myself in therapy. But yeah, so I hope this gives you an idea of what therapy is and is about. I know it's just the gist of it. It's the tip of the iceberg. There's so much more to it, but you're not going to fully understand it until you get into it. And it really is beneficial to find the right therapist and the right modality to address the issues that are specific for you. Everybody's different. Nobody's the same. I have not had 2 clients that were identical, period. It never happens. Every single person's different. Every single approach is different. All right, so that's it for this video. Subscribe, don't subscribe to the channel. It's up to you. It would definitely be helpful for me. Make comments below. Don't make comments below. It's up to you. Just know, as with all my other videos, I'm not going to read comments. I honestly don't have time. There's just a lot of stuff that I've got going on, in my own life, my own experiences. To be honest, I really had to pull a lot of effort just to make time to make these videos, because I really believe that they are important. So anyway, having said that, I hope you have a wonderful evening, day. I hope you have a wonderful life. Take care of yourself. If you feel like you need help, please find somebody to talk to. Find a therapist. It is not a bad thing. All right. All the best to you. I do hope you have a wonderful life. I love you all. Take care.